Welcome to PT Chit Chat. Merry Christmas and happy holidays to everybody out there. Welcome to PT Chit Chat episode number 2. What's up,
going
Nico?
on? What's up,
man?
Payman? What's
Glad
going
to
on,
be
man?
back and recording again. Let's get it.
I know this is so exciting, dude.
Man,
I'm
we
having
had
a great time.
so much good feedback, right?
Yeah.
So much feedback. And for all you out there who said my camera wasn't facing not facing my face, guys, this is the best I got right now, man. Give me some slack here, man. I just moved into this place, so we're working on it. Yeah,
We are working on it. Payman has just literally lived there for a week and a half, 2 weeks.
and a half now. So
Yeah.
I'm working on it. I got the camera on this side, and I got 2 monitors in front of me. So,
It's in the works.
we're working on it. And to everyone that said we talk too much PT jargon, I got you.
We're working on it.
We're working on that too.
Thank you. Love that.
Yeah.
Also, our mic situation. We had to move our mics.
Yeah. I guess we were a little bit too far away from it, and people couldn't hear us. So
Yeah.
so we got that sorted out. But yeah. So we had a question, right?
We did. We had a question.
I think we're gonna start addressing questions in the beginning of the podcast. Just one question that you guys have asked us, and we'll address it. So Nico, what we got?
Yeah. So somebody asked us why we don't base our treatment off imaging. That's a really good question. So to kind of so there's a lot of research that says imaging isn't really the best, especially for physical therapy. So before we get into that, there's 3 types. Well, there's multiple types of research, but there's different levels. So the highest level of research is a meta-analysis.
Is this classified as jargon, by the way?
I know. This is a little bit of jargon. This is a little bit jargon. Just means like whatever. Anyway, so the first type, the highest level, meta-analysis. Then what's after that, Payment?
CATs or clinical appraised trials or something?
No, not systematic reviews.
Yeah, you're right.
And then randomized control. So randomized control is what you typically think of a research. Meta-analysis and systematic reviews, that takes all of the research. They look at everything and they take all the research and put it all together in one thing. So there's some really great research out there, guys. So there's a bunch of research. Nakashima and company, they did a research in 2015, and they found that there is in 87% of the population that got an MRI, they have a disc bulge, but they don't feel any pain, nothing, no symptoms, asymptomatic. 87%. That's a lot of people. Then we have in a systematic review. So this is the second highest level research in Brzezinski and company. This was done in 2015. Yeah, sorry if I'm butchering the name. So Brzezinski and company, disc degeneration. 96% of 80-year-olds had disc degeneration from an imaging, and they had no symptoms.
So what you're saying is basically that we can basically be walking around having these conditions,
Having all these conditions,
but they may not necessarily cause us any issues in our day-to-day life, right? So
exactly. Culvener and company, they did a systematic review, second highest one on knees. Again, 43% had a cartilage defect, 20% meniscus, no symptoms. There's
a bunch of others, right?
There's a bunch of other ones. Morton's neuroma, there's ankle sprains, 40%. Hip pain, 68%. They all had hip stuff in the imaging and nothing, no pain, no symptoms, nothing.
So the moral of the story is like somebody comes in, right, Nico? So somebody comes into your clinic, for example, and then they say that they have these conditions and they're like, bam, ultrasound, right? Now, it's not like, yes, it may be that on the ultrasound, but it may just also be something else, possibly.
Something else, yeah. So that is why physical therapists don't typically use imaging to guide our treatment, because you will probably find something on that imaging, but that doesn't necessarily mean that is the reason why you have pain. That is the reason why you're lacking function, right?
Yeah. So now, having said that, obviously, let me hit you with one. So let's say you have like an athlete, right, and the athlete kind of sprains the ankle, right?
Mm-hmm.
The ligament on the outside of the foot, and with that, now they come in and it shows up a tear, a partial tear.
Right.
Let's just say half torn, right?
Sure.
And then you want to know if that tear has gotten better after physical therapy. It makes sense to do another ultrasound, right? I mean,
Sure.
so in that case, like yes, imaging is useful. But I think the moral of the story is that it's not the ended be all, and other factors should be taken into consideration, right, Nico?
Exactly. So we don't. Yeah, that's exactly right. We don't always use it. For ruling in is okay, but really we just want to make sure that it's getting better. And so that, yeah, like you said, that is when it's very useful.
So hopefully that answers the question from who did we got that question from? We got a name
Uh,
or
yeah, that was from an SLP. I'm not gonna say any names because we want to keep this podcast anonymous. But yeah, that was from a
confidentiality. All right, I like it.
confidentiality. Yeah, that was a SLP. So we have a bunch of people listening to our podcast, Payment, even
Oh,
non PTs.
very
That's
nice, very
crazy.
nice. What do we
Yeah.
got for today, though? What's our topic of the day?
Okay, so I thought we should talk about physical therapy, right? Like the first main episode that we're having, we should talk specifically like different kinds of PTs.
Like, what is it that we do, right? What are we?
Yeah, what do we do? Who are we? Where do we work? Things like that.
All right, get the ball rolling. I'll let
Okay.
you start this one off. Put you on the spot for this one.
Put me on the spot. Shoot. Okay.
You already
Um,
know.
so Payman, tell so there's obviously different types of PTs, right? We work in different settings. Um, explain them. Can you let everybody know where we work, the different types?
How are
Like
you
the
gonna
different,
bounce this back on me?
the different
All right, I got you.
yeah, like the different places of PT.
Yeah,
Or like,
yeah. So, I mean, in school, obviously, you learn a bunch of different settings, right? You got the,
sure,
I mean, I could be off, but we got the orthopedics, right? We got the
good orthopedics.
cardiopulmonary, we got the
Okay,
pediatrics, we got neurology. Now, let me just go into a little bit more specialties like oncology, which is basically
good.
cancer treatment.
Uh-huh.
Um, you got geriatrics, dealing with the
Which is the
adult
older
population.
population. Uh-huh.
So yeah, older, not adult. And then what else we got?
Lymphedema.
Yeah, those are a little bit more specific. So working
Yeah.
people with specifically lymphatic issues and stuff like that.
Pelvic
Um,
health, women's
oh yeah,
health.
you're getting really pelvic health.
Yeah.
So long story short, there's a lot I don't know if that's out there, but I think the four main ones are the you know neuro, pediatrics, orthopedics, and cardiopulmonary. I would say, and then just looking at different kinds of settings you could work at, anywhere from. Well, actually, we can work anywhere, right? You can even work from home.
That's
To
right.
to be quite honest with you, but maybe not everything from home, but most things on this. Needless to say, but
So
so
where's the typical setting? Where like what are some
the
typical
most common
settings?
settings you're gonna come across are your outpatient clinics that you probably. I mean, in Canada, they're in every corner, so it's like a corner store in this place. So a little bit saturated, but
But
no,
that's what you think of when you think
that's
of
what you.
typical
That's
PT.
probably what people
Yeah.
think of when they think of PT. It's like your shop. You just go in and you kind of get treated for it. And the
Mm-hmm.
other place you probably think, but you don't really think is a hospital, the
Yep.
hospital setting.
Hospital
Um,
settings. Yep.
or maybe
Nursing
that is
facilities.
maybe the hospital is the most common one people think. I'm not sure actually.
Yeah.
I'm gonna have to ask people about that one. I don't know.
That's a good question. When people think of PTs, do they think of
Yeah,
hospital PTs or do they
yeah.
think outpatient? That's a good question.
See, I always thought outpatient because I never really been to the hospital per se. So,
Yeah, me too. Whenever I
um,
think PT, I think outpatient in a gym, stuff like that.
yeah. So you got those settings, and obviously you can work in school, but again, those places
Hmm.
people don't really think PTs.
And then nursing facility.
Oh, that's the other one. That's the third biggest one. I would say outpatient, hospital, and nursing homes.
Yeah.
As the top three settings that most PTs work at.
Okay.
I obviously work in outpatient. We talked about this in podcast one. Nico works in
Everywhere.
everywhere. He doesn't exactly stay in one spot.
Yeah.
Um,
Okay,
but
so
yeah,
let's talk a little bit about what they do in the different settings and what the goal is. So let's start with, the people that the highest acuity or the people that need therapy a little bit more to kind of outside there.
no,
Um,
I don't have much experience with people in acute care settings. I did one clinical rotation. That we'll
okay.
talk about clinicals way later on. Not in this
Right.
podcast, but I did one at Concentra care. I did. It was like
In the
a
hospital?
no. It was like a it was like subacute. Which
Okay.
now we're
So
getting kind
let's
of technical
yeah.
between acute, subacute. I'm not the best one to explain this one though. So
So let's start with the hospital physical therapy. So what to kind of expect if you have a physical therapist in the hospital. Um so the biggest goal for hospital PT is, can we get you moving, and how do we get you safe enough to go to your next level of care, whether that means in a nursing home or back home to your place, right? So our biggest goals are, how well do you move around in the bed? Can you get up and down? Can you walk? Do you have stairs? So things like that.
Wait, so
That's
you're
kind
telling me it's not just about walking them?
No, it's not just about walking them. I mean, walking is a
I'm just
very,
kidding.
very important part, and that's kind of, so when you think of hospital PT, you kind of think of walking, but there are a bunch of other goals that we have, but we basically want to get you safe to the next destination,
And
right? Whether that,
a lot of the hospital stuff now, you got the post-op patients. We were talking about
yeah,
like knee surgeries, hip surgeries. PTs there are the ones that are on the front line, getting kind of um, getting them situated and moving right off the
day
bat.
one, day one, day
Day one,
zero,
yeah,
day
day
zero.
zero.
Honestly,
Actually,
honestly,
some do pre physiotherapy. Some do
yeah,
pre physiotherapy, and that's been shown to improve function, right?
yeah,
Pre
but yeah.
physio, pre function correlates with post function after surgery. I think there's a study on that. I'm sure we could find it,
Yeah,
but
no, that's correct. That's correct. So yeah, in the hospital, that's the goal. So we're not doing high level stuff. We're just making sure that you're okay, you're safe. You're not gonna fall, things like that. So from a hospital, there's two options now. Typically, you can go home or you can go to a nursing facility. So those that go to a
or
nursing facility
outpatient.
or outpatient, yeah, yeah, yeah.
Yeah.
But I mean, they do end up going home, and
I mean,
then they
going home is
gotta
the same as like outpatient,
yeah,
essentially,
yeah, and then
right?
going home, and with going home, you can get home physical therapy where they come to your house,
Yeah, yeah.
or you can go outpatient. But yeah, so a nursing facility, that's kind of a place where you just need a little bit more help, right? You need to keep working on your strength. You're not transferring safe enough to be safe to go home, or you're having a hard time walking, and that's kind of more rehab. But again, we're not doing high functioning stuff. We're doing pretty much, everyday things and making sure that you can do them.
Yeah, so like sitting to standing up, or like you mentioned, walking, stair climbing,
Right.
getting in and out of bed, right? Moving and rolling in bed, simple things.
Yeah, so that kind of stuff. So,
Or simple
yeah.
to us, I should say. I shouldn't use the word simple like that. It's simple
Yeah.
to us, but when you're in that condition, it's not exactly a simple thing to
Yeah,
do.
it's super hard, and people struggle and people have a hard time, but it's something that we probably take for granted because we move fine. And,
Yeah.
and and I hear it all the time. People are like, "Man, I've never had to think about standing up so much because
Or
I've
walking,
just
right? The
or
most
walking."
common one is
Yeah.
like, whoa, I have to think about walking, especially after a fracture, right? It's
Yeah.
incredible, yeah.
Yeah, it really is incredible.
But I don't know what that feels like, so it's hard to relate on that one. But people do tell me all the time after a fracture, like, "Oh man, I can't, like, I don't know, I forgot how to walk," or like, I- and it's like crazy because it's like second nature to us, right? So
Yeah, so that exactly. So that's very important. You got to make sure that you walk correct, or else you don't want to be walking with bad form for the rest of your life.
yeah,
So
I mean,
that's
those are
why,
things we can kind of talk about like more
yeah,
specifically.
yeah. So that's why
Yeah,
that's why it's very important to, even though that kind of therapy is very, very important, even though that's not everybody's cup of tea.
yeah.
Acute, working in the hospital and a nursing home is very, very important. You got to be able to do that stuff. You got to be able to be safe.
Now, can you kind of differentiate between kind of the subacute versus acute um, setting? Do you know the difference?
Yeah, so when I think subacute, I think similar
Like a
to,
transition, right?
yeah,
Almost.
like a transition. Similar to a nursing home. Um, so depending on where you are in the country, there's different, settings. Like there's subacute. Right now, I'm currently working in a swing bed, which I was like, what's a swing bed?
Wait, hold on. What is a swing bed? Hello. No, seriously though.
That's when everybody tries to practice and get good on swings, Payman.
Oh, okay. All right.
No, no. So swing bed is just like a subacute. Yeah, it's like a subacute
Wait, did you
basically.
just troll me? You just trolled
No,
me.
no, no. It really is a subacute. So it's called swing bed where we are. It's similar to a nursing home. Again, it's just different levels of care. You're a little bit better than being in a hospital, but you just need a little bit more help to go to a nursing home. So it's kind of like in between.
Wait, so you're telling me it's like hospital, swing bed, nursing home.
Yeah, and
Okay. Yeah.
subacute is the same as like
Yeah.
swing bed.
I mean, I worked in subacute, right, at Concentra, and it was basically like a lot of workers comp, I guess, where they were getting injured,
Okay.
and let's just say 4 days out, or actually, some of them on the day out would just see us and would kind
Yeah,
of get to work,
I
And I
worked
think
in a
that
like that
to
too.
touch base on that actually is that it's a little bit off tangent here, but a lot of people get injured, right?
Yeah.
And you know what they do?
What do they do?
They wait.
Oh my gosh, that's the worst thing.
They wait, right? They
Oh
wait
my
before seeing
gosh.
if physical. Okay. I shouldn't say physiotherapists. They wait till they seek help.
Yes. Why
And
is that bad?
before we get to why is bad, I'll tell you why they do that. And they go, "Oh, I just want to see if it gets better by itself." And to be honest, your body is really good at healing things.
Yes, we are strong,
But you
guys.
know what they do? They go and research things. They try to kind of do stuff on themselves, and we know that. Oops, I just hit the mic. But we know that like certain exercises are beneficial for one thing and
Right.
not so beneficial
For
for
other
possibly the
things.
other things or possibly even the
Yes,
same condition.
that's
Um,
right.
and person A and person B may have complete different experiences, right? And we talked about sciatica on podcast one on how that could be
Hmm.
different. But yeah, man. So waiting, you
Stop
know,
waiting, guys. Please stop waiting. If you're hurting, get help. You know,
even yeah,
if you had an injury for let's say a month compared to a couple days, you will heal much quicker if you're doing the right things. If you go a couple of days after the injury compared to if you wait a month, if you wait, a year, because those problems that becomes harder to treat. The longer that you've had that problem, it becomes
because your
harder to
body's in
treat.
that prime condition. Like it's already alert about your injury. Like it knows about your injury. You got injured. The injury is like it knows, right? It knows.
Yeah, it
Now
knows.
it's just a matter of guiding it in that right direction, right?
Oh,
Right.
yeah,
And then ultimately essentially healing it, right? And then
right.
people tell me, "Hey, Payman, I'm in pain. Why would I exercise? It just hurts more." And I'm like, I get what you're saying. I totally get it. But if you're not working the muscle, you're not getting blood flow to the muscle, right?
Yes.
um you're not getting blood flow there, so
Which
but
which reminds me of something, payment. So you've heard the saying rice, right?
yeah, well, it's changed now, isn't it? It's like
Yes.
there's something else on it now, isn't there?
So rice is rest, ice, compress, elevate. Um, and that's what people used to say for injuries, but we don't love that.
We don't like R anymore, do we?
No, we don't like that rest. So the new saying is Arita.
Sounds
A
like a
A
dance.
Arita. Active recovery is the answer,
I
which
like that
basically is
actually.
a movement, guys. Movement is the best thing. I'm sick and tired of people saying rice, rest it, compress it, ice it. Sure, like that has a
There's
time and
there's a time and place
there's
for
a
that,
time and place,
exactly.
sure. But really, active recovery is the answer. Your body is strong. Your body can find a way to fix itself by moving, not by laying down and just resting for however long, thinking that it'll get better.
I mean, physiologically speaking, what's happening when you're resting, right? I mean,
Nothing.
essentially something that heals a scar tissue, right?
Right.
The whole concept of like massage and soft tissue mobilization techniques, or like instrument assisted soft tissue mobilization,
Right.
you're
Why do we
trying to
do
get
that?
because you're trying to get blood flow to the area and also align those fibers, right?
Right.
To promote optimal healing. I always tell people it's like a chain link. Imagine a chain link, couple chains, when people have knots or whatever, same scenario. So those chain links are, compressed. And if,
Okay.
if it's a giant chain link and you got a couple compressed, it doesn't move as freely, right?
Yes.
It's not the optimal function. I think the whole basis around like foam rolling probably was around that. So
Yeah. So,
back in the day, but
but the at the bottom line is movement is the answer, right? It creates blood flow, and when there's blood flow, there's a lot of healing factors and that go to that area, and that's what we want.
so Nico, we talked about movement being like a factor, obviously. Now, what if they're in so much pain? Can they still do exercises? And we both know the answer to that is yes. But
Absolutely. Absolutely. And that
because
is
there
my
is a
biggest thing.
point where you can act. So I'm just going to give an example to everybody out there who's actually suffering from a lot of pain. That's not to discredit pain. Obviously, there's ways to manage it, but
Yeah, pain is very important.
very important.
We do care about your pain.
Exactly. And I don't know if we made that clear on podcast one, but we just want to make that clear that we do care about your pain. And, you know, pain management and
Pain
improving
science and that
function
stuff.
they kind of go together.
Right.
But there's a concept called pain-free range of motion, right? So ultimately, what I mean by that is that, let's say you have a shoulder injury and you can't lift your shoulder up. I guarantee you there is a certain amount of motion that you're able to lift your shoulder to. And that amount of motion is likely pain-free. So
even if it's just a few inches.
Right. And you can still, now I know therapists say you got to get active motion first before strengthening it. Honestly, I've been having good success with still strengthening within the available motion that they got. Obviously spending more time on the range of motion, but still kind of strengthening that available motion. So
right. So yeah, even so you're telling me, Payman, if my shoulder hurts, it's still beneficial if I move it like
to
5
move
inches
it
up.
under the direction, guided movement. So obviously, you know, if you got a wound, right, we're not going to keep poking a needle at it, right? It's not going to heal. But
wait a minute, physical therapists can do wound care?
We can, but we won't talk about that because I'm terrible at that.
Yo, I do so much wound care.
Okay, there you go. That's a podcast for Nico. but no, I mean, you have shoulder pain. There are certain movements that you can do that's going to help you.
Right.
Now, okay, I'm going to throw PT jargon. It's the most, you know, you see this a lot.
That's
Let's say impingement here, which basically means, well, it could mean a lot of things, but
there's some sort of pinching somewhere that's causing pain.
Right. Am I going to have Nico do a shoulder movement that's going to keep recreating that impingement?
Heck no.
Absolutely not.
I'm not going to want to move. If it hurts, I'm not going to move.
And that's bad business. He's not going to want to come back to you. And that's not good on you. But there are movements that Nico can do
that's not painful.
That wouldn't be causing that pinching per se. So,
and the reason why we do that is to get blood flow to that area. That is the most important thing.
It's so simple. Blood carries nutrients. That's really all there's to it. Done.
Blood carries nutrients. It carries all these healing things. It's very important.
And which is why, you know, you get sometimes knee injuries with like different parts of the meniscus that just don't happen to heal as well because there's no blood supply.
There's no blood supply, yeah.
But
or the bone in your wrist, the scaphoid. It's a bone in your wrist.
And you would know about that, right, Nico? You had a story about that, right?
That's right. I broke my scaphoid. And I had to get surgery on it. Yeah. But yeah, again, it didn't heal because it had poor blood flow. So that's why blood flow is very important. Any movement is important. It's vital, even if it's just a little bit, guys. It is going to help you. Do not rest and not move it.
Yeah, don't stop moving.
Don't stop moving.
Don't let. You know, when I said function is key, obviously I didn't mean to discredit pain, but what I meant to say was don't let pain control your life.
Exactly.
I want you to still kind of enjoy your life as much as possible, and I promise you the pain will resolve. Like
pain will resolve.
Nico, I had shoulder pain for 6 months.
Yes, dude. I remember you telling me about that.
Man, all throughout PT program, I had shoulder pain. I came to Canada and I still had shoulder pain, and it got better. Right, I worked on it. Mind you, I did no like joint techniques or anything, right? PT jargon, but I strengthened it. Purely strengthening, rotary cuff strengthening, you know, posterior kinetic chain, so the back strengthening, all that good stuff. And it got better. And then I hit the squats one day and somebody put the 25 pounds and the 10 pounds in the same spot. And whoever did that, I really hate you. So I didn't look and I grabbed the 10. I put, you know, I put the 25 on one side and 10 on the other side.
Oh, no.
I did have 2 more 45s there, guys. I don't squat that.
Oh no!
But I was off balance, and I was like, "Oh, this feels weird. I you know, am I not bracing my core enough?"
And you didn't know, so you just kept going.
I just kept going. So
because you didn't know.
Later that day, the shoulder suffered, and sure enough, the injury flared up again. But you know, it took. Oh, man. You know, it's funny because I reached out to physiotherapists out there and some physical therapists from the U.S. I'm not going to name anyone, and they're like, "You know what? You may have to just deal with this." And I was like, "Come on,
that's not okay."
I was like, "No."
That's
You
not
know,
okay.
and we can make a whole podcast about how I hate the word chronic, but
Oh my gosh, I hate the
we're
word
not gonna we're
chronic.
not gonna we're not gonna talk
Or
about
I hate
chronic.
I hate when people say bone on bone. Like I hate those
We're,
types
we're
of
not gonna
verbiage.
that will come later in the podcast.
Yeah, I
But
hate it. Ugh.
yeah. Long story short, I did heal my shoulder, but it took 4 to 6 months. And there's a story about my knee. Same thing. I was squatting heavy. I was stupid, and I was my knees were trailing forward. I was doing ego lifting, and my left one, I actually ended up having like an Osgood Schlatter.
Oscar Slaughter.
And there's a bump there, and I went to the doctor. I even messaged PTs, man. And I said, hey, look, I got this. I didn't think adults could get it, right?
Right.
Um, and then that's it's what it was. And I was like, oh man. And they're like, and everybody was like, oh, you're gonna have to kind of deal with it. I hate that answer. You're gonna have to deal with it.
Oh my gosh. So let's talk about that payment. Um, so not every physical therapist is the same, right? Just like every other profession, you're gonna have really, really good ones
And
and
some not so good
really,
ones. We're not gonna.
yeah,
I don't
and
want to use the
some,
word bad. I think we're just gonna say not so good ones. I think.
yeah. There's definitely different tiers of physical therapists, and we're not saying we're fantastic.
Oh,
No,
I
yeah,
man, I
we're
just signed up for like new courses online, and like I'm still like learning. And that's the beauty of physical therapy. You don't. There's no way you can learn everything. It's frustrating, and because it's frustrating, it's beautiful.
it's beautiful because you just want to learn everything and you want to
Pretty
be the best
much.
as you can, right? And
I
you
mean,
want to
that's
just,
that's us, right? But we're definitely
yeah,
not even close. We're not even close. We're probably at the
we're,
bottom, but
yeah, we are not close, guys. We're not saying we're fantastic.
we're definitely not.
And
Yeah.
we love learning from different therapists. I'm constantly learning. I learn from everybody. So yeah, there's different kinds, right? We have really, really good ones and ones that aren't so great. Just like clinics, we have really great outpatient clinics, and then we have ones that aren't so great. So Payman, let me ask you. So let's say I have an injury. What should I look for in a clinic, and what should I look for a physical therapist?
I think
What are
honestly, so the
signs?
first thing you want to do is, I think not a lot of people do this. So at the clinic I work at, we got 3 therapists, and we each kind of do different things.
Okay.
Um, by that I mean we got a McKenzie therapist out there.
Mm-hmm.
McKenzie's a different approach to therapy. We got another one who is again probably more in line with what I do, is soft tissue work and joint mobs and stuff like that. And
Okay.
I obviously and exercises, and I like to combine. I like to do a little bit of everything. I just like to combine things and cater it to we talked about, I think, was it the first podcast, crayon approach? I don't know.
Yeah.
Yeah,
The
yeah,
crayon
okay,
approach. Yeah.
yeah. So different colors, draw your own art, for that person. But what you can expect, what I would do is actually when you call in anywhere is like ask the receptionist and say, "Hey, I got this injury. Who is most suited to work with me?"
Right.
And kind of get an idea what that therapist mostly sees. Like for example, if you bring me like a back surgery, I have no idea. Does that mean I can't learn it? Yes, I can learn it. Can I treat you? Absolutely. Can I treat you
Right.
to the
And
best of my
you'll do a good
ability?
job.
I'll
Of
do a pretty
course.
good job. Will
You'll
I
do
do
a
the
good
best
job.
I can? Maybe not so much as a knee surgery because I see a lot
Right.
of knees.
And
Um,
is there other people in your clinic that do
yeah,
much better in the back? Of
exactly,
course.
100%. And I think as a therapist, if they got referred to me
Mm-hmm.
for that, I'll actually tell you a story. So someone got referred. I had this kid, and he had an elbow issue, right?
How old was he?
About 6.
Okay.
He had an elbow issue. They did surgeries on him, uh, and long story short, he couldn't extend his arm. Um, he couldn't extend it fully, and
Couldn't strain it out. Okay.
yeah, couldn't straighten out. It was actually a Salter type 2 fracture. Um,
Oh.
if that's a little bit PT jargon, but Nico will
Yeah.
understand. It basically just, anyways. Nonetheless, it doesn't matter what it was. He couldn't extend his arm, and I don't work with kids,
Right.
so I did the right thing. I didn't keep charging her for visits. I referred her out to someone that may be more knowledgeable. And I think, that's what I mean. When you look for a therapist, A, know what your injury is,
Right.
and
Or have
B,
an idea.
have
Like
an
have a
idea.
like
If
a
you have
body
an
part.
have
You
an
know, a body
idea.
part.
And B, don't be afraid to ask the receptionist about who works with what. If you're an athlete out there, ask for someone who's worked with athletes. If
Right.
if you're an older adult, ask for someone who works with that population,
And
because
just payment, even
yeah,
aside from orthopedics, clinics are going to have a different, a therapist that maybe specializes more
and
in
neuro, yeah,
neuro,
yeah, yeah,
yeah, or
absolutely. No,
orthopedics, or somebody who's really into cardiac and stuff with the heart and heart problems. You're going to
yeah.
have different therapists.
And honestly, I know a lot of people may, I don't know if they're thinking this is like, oh, well, aren't you a physiotherapist or a physical therapist? Did you not pass the license exam? And yes, we did pass the
We
exam,
did.
but the amount of information that's out there is a lot. And can we treat any condition that comes our way? Absolutely.
Absolutely.
Um, can we treat them to the best of our ability?
Absolutely.
Absolutely. But can we treat them to the best possible? I don't think so.
Yeah.
Depending on where your interest and expertise were
Right.
or are, I should
Right.
say. So, like again, for me personally, I specialize in post-op knees, shoulders, ankles, Achilles, all that stuff.
Right.
And I see a lot of your general stuff, your low back pain, neck
Right.
pain, and
And if somebody
yeah,
with a stroke came to you, you would do a fantastic job, but somebody could do better.
absolutely. And I'm just going to throw PT jargon out there. I'm sorry, guys, but someone comes in with stroke and um, or CVA, right, or
Right.
whatever, and and yes, I can assess and see where they have stiffness, where they have spasticity. Again, PT jargon, but ultimately, and I can set up a treatment plan to kind of help with that. But I don't know every single up to date technique right now on it.
Right.
And there's different approaches that we I could spit out random gibberish at you guys. Bull bath, NDT. and, Nico,
Ooh, hit me with that bow
and
bath.
Nico goes,
Okay.
oh, okay, I don't want to remember all this.
Ooh, no, I love the okay, okay.
Or but yeah, no, I funny enough, I actually, coming out of school, I did do a PTA assistant on a patient with a stroke, an SCI. I shouldn't say stroke, SCI injury. Um, and
Spinal cord injury.
yeah, yeah, thank you. But they're like, guys, no PT jargon, and I think I've like spent 5 minutes on PT jargon.
No, but it's good. It's good to know like the actual name, and then like it's good to kind of explain
All
what
I
it
know
is
is if you
too.
guys hate on someone, hate on me. It's all good. But no, long story short, yes, we can treat them, but please, there's therapists that are specialized in different areas, and seek the one that specializes in that area. They will be able to help you out the most,
Yes.
and seek
Yes.
therapists that are willing to refer you out if they realize they cannot. Because I don't want I hate the concept of people just, I'm sorry, but like milking you for the cash flow and trying
Uh
to constantly see you and stuff, right?
yes, and I've seen coworkers do that like so many times, and I'm just like, can you please just
And
refer them out?
right. So what would you, okay, so having said that, what would you say is like a typical timeline that, let's say somebody's seeing a physiotherapist and they just don't get better? What would you say? When
So
should they stop going to physio? When should they kind of, voice their opinions and be like, hey, you know what? Hey, look, I'm not getting better.
hey, yeah, okay, so that's a fantastic question. Um, so it does take time
I'm gonna
for
take a drink of my sparkling water. So for all you fans out there.
so it does take time for an injury to heal, right? So I don't want to say after one visit leave. Typically, guys, 30 days. If you don't see any improvement in 30 days, that place isn't for you. And the therapist should be looking for other places for
Well,
you.
okay, hold on.
But
I don't want to say that place is not for them. Maybe let's
that
just say that
that
treatment's not for
that
them,
yes, okay, yes, good. That
or
treatment
yeah,
plan, or
or maybe they're diagnosed wrong, for example,
yes,
or
yes.
maybe that there's another underlying issue going on
Yes,
that
that
requires
something
further
needs to be.
referral. Yeah.
Yes, that is a
So
much better
let's not
answer.
just say
Yes.
it's
Yeah,
because
that's correct.
it could also
Um,
be that that person is not knowledgeable enough, but that's
right.
not, we don't
Yeah,
want to
so
get there.
something is not working, and so if you're not seeing any benefits, then change. But personally, I know from the get-go, if I feel uncomfortable with something, or I have a coworker that's more knowledgeable, or I know somebody else in a different clinic that works in town that's more knowledgeable, I'll refer them straight away from the first visit. Especially if I just want people to get better. I don't really care if you come to me, if you come to somebody else. I want you to go to somebody who is knowledgeable and will get you better quicker. Because that's what it is, right? You don't want, yes, you can get better with me, but it'll take longer compared to somebody who knows that specific thing way better than me.
Exactly. And I
right?
think, I always tell people I go, the optimal tissue healing time is what, about 6 weeks, right?
Yeah, six
Um,
weeks.
6 weeks, and I would push it as far as maybe 8 weeks.
Yeah, 6 to 8 weeks.
Um,
So give it time.
Even maybe longer in some cases, but for just a general for the general basis, it's around 6 to 8 weeks,
Right.
right?
So please give it time. Give that treatment method time. You're not gonna see strength gains and stuff like that
And
right
stick
away.
to it, right? Stick to the
Stick to it.
consistency. Don't give up on
Yes.
it
Don't give up
necessarily.
on it. But after 30 days, 1 month, and
If you
you
still have
haven't
no
seen,
change, yeah,
yes, then look for something. Something needs to change, right?
yeah.
Okay, payment. So we talked about therapists. Now, what about clinics? So you mentioned that there are so many clinics.
Oh, there's
Um,
tons of clinics in Canada.
so what if I'm a patient and I'm injured? What should I look for? What is a good clinic in your opinion? And what kind of settings should I look
You-
for?
Well, that's a great question. Again, it kind of goes to the idea of knowing your injury. In Canada, we have a couple specialized like neuro clinics, like they're concussion based clinics. They just focus on concussion.
Okay.
Um, there are clinics that are more outpatient. That again, the clinic. I wouldn't say about the clinic because the clinic can have therapists that are specialized, right?
Mm-hmm.
But for something special like concussion, the equipment varies, right? Quite a bit.
Okay.
But on a general basis, when you go to a clinic, you need to. I'm gonna be a little bit nitpicky, but you want to make sure it's clean, right?
Right.
It's got to be clean, right?
Absolutely, especially nowadays.
Especially, I mean, yeah, now for sure. I think most clinics in Canada are doing a pretty good job of on that, but
Yeah.
um, it's got to be clean. Uh, the equipment's there for you to work with, right? Um, and you can kind of tell, you
Well,
know,
what about ratios? Talk to me about ratios.
ratios PT to TC to
Yeah,
patient.
yeah. That's kind of
Ooh,
more what I want
that's
to
a
talk
hot
about.
topic.
I know, and let's get
That's
into it. Let's let's spend
that's
some time
that's a really
talking about
hot
ratios.
topic.
I know.
Um. Okay, so but that's a hard one
I
because
know. I know it's hard.
the thing with ratios is that again it depends on the essentially speaking, I'm for the concept of like what do you do as a physiotherapist or physical therapist? You do
Uh-huh.
you do your manual techniques, your hands-on techniques, right?
Right.
And then you also prescribe exercises. um do you need to watch them do exercises after the first time? Hmm.
Everybody's different. Some people
it,
need to, some people don't.
yeah, it depends, but let's just say that they're comfortable doing their exercises, you've corrected their form, they understand what they're doing, they come in the next session, you're not changing anything, do you need to watch them do exercises? And you can certainly delegate that to an assistant, right? Are you still kind of overlooking them? So yes, you are. So
Assistant or tech? Because assistant, they can do that stuff. You mean tech, right?
we use a kin in my program. We
Oh,
like
okay.
using
Canadians.
kinesiologists.
Oh, okay, okay. So
Um,
that's in America. That's like a PT tech or PT aid,
yeah. Anyways, yeah. So there's different terminology
right?
actually.
Not non-licensed therapist.
Okay, so assistants in U.S. are not licensed.
No, PT assistants
PT
are
assistants are
licensed.
licensed, and PT
Yes,
tech is not licensed.
PT techs, PT
Okay,
aides,
so
they
they
are
got
not
different
licensed.
hierarchies. In Canada, we have PTAs, but I don't think there's a board in Canada for PTAs. Anyways,
Mm,
we use kinesiologists where I work, so
okay,
um, obviously kinesiologists are a regulated profession in Canada. They're licensed, so but again, so I work when I work with somebody, it's my one-to-one time with them.
right,
My manual therapy is a one-to-one time with them for 20-30 minutes.
right.
That's and there are times I actually you know what I think, yeah, I actually spend the time with the exercises too.
Yeah,
um on the first day I like to do the manual hands-on approach. I like to do the stuff they cannot do at home.
right, right,
um and then kind of go from there. And so it's hard to answer, but for me, I'm all for the one-to-one.
right,
Now, having said that, if somebody is kind of an exercise-based therapy, then absolutely I can kind of delegate that and keep an eye on them.
right.
And
And
it's yeah.
and I'm okay with that. I'm working with, two patients an hour. Preferably, I would love one to one, and I have worked in many clinics. That is one therapist, and I get to see a patient for 1 hour, just them. Some people don't need that. Some people don't even want that. Some patients don't want that. They'll like leave me alone. Like I'm fine. But the problems that I have are the places where I'm expected to see 4 patients in an hour, 5 patients an hour,
Okay,
and
so how do you think people manage that? How could you possibly manage for an hour? How you know?
and honestly, when I did it so when I was in school and during clinicals, I had to do a place where I had to do 4 patients an hour and
Same.
walk in evals on the same day.
Yeah.
Like, and that is personally, I felt that I wasn't giving good care. And so
You were probably giving good care, but you were likely not giving personalized care.
yeah, and
There's a
it's just
difference. I think you were still probably giving pretty solid care to the best of your
it
ability,
to the best of my ability at the time. But
but you were not giving personalized care.
I know if I had less patience, I could have done a better job. And to me, how good can your treatment be if you're seeing 4 or 5 patients in an hour? You know? So I avoid places anytime I see a place that even mentions 4 or 5 patients an hour, I just say no. Like
Because
I
what does that
absolutely
look like to you? So here's what I get when someone says 4 to 5 an hour. You're either putting them on the electrical stim machine.
yep, which is a modality. And I personally, my view
Um,
on modalities, I don't
we
like
can
them. I don't
always
like
talk
doing
about
them.
modalities.
Yeah, I don't do them.
I'm 50-50 on them. I do them.
Okay,
But
they have a time and place. I personally
again,
don't use them.
I'm not a all for non approach. I'm a take a little bit of take a little bit of everything and mix it and make your own cookie approach.
Right.
But and then what else does it look like? Possibly just exercises.
Exercises on a couple of people,
Um,
doing manual on somebody. So that's what it looks like.
so
And
or you know the one way you can actually give good care, if someone actually asks you, if this is for all the students that may be kind of looking for jobs and they kind of land a job, or not students but PTs that just graduated and they find this job and
right,
it says 4 to 5 an hour. How would you go about managing that clinic? Is you could do 15 minutes of manual, right, and delegate the exercises to the kin or the
right. The
physiotherapy
the
assistant or
assistant.
tech or
No,
whatever.
not the
Not
assistant, dude. The
the
assistant
tech,
is licensed.
the
Yeah, the
tech,
tech or the aide.
the tech or the aid. Oh,
Yeah.
sorry, man. Americans. I'm kidding. They're still using miles for some reason. I don't know why.
I know we're the only place us and like a couple of the countries.
The whole world's
I
using
know.
metric, and these guys
I
are using
know. It's
miles.
ridiculous. The metric makes so much sense.
Whatever, he's still in like king queen times, but um, but no. So you could still manage it. It's still doable. It is still
Yes,
doable. So you
it
can
is.
still do 15 minutes manual. Is it the most best possible?
For the patient,
No,
nah, yeah.
I would
At the end
probably
of the
say
line, my opinion, and it's different from other physical therapists. I'm sure we're gonna get some flack from this, but in my opinion, you can't give your best possible care if you're seeing that many patients,
because Nico,
and
go ahead.
it causes burnout.
Burnout, yes. Another episode. That's I'm
Yeah,
not
but
going to touch
it
on that.
does cause. I mentor a bunch of people, and somebody I know somebody that works in Chicago, and he took a job like that, and he sees 4 or 5 patients an hour, walk-in evals, things like that. Great benefits, places like that make a lot of money. Great benefits, um, tuition reimbursement, stuff like that. But he is, after working there for a year, just super burnt out.
Again, I'm sure we'll touch on the whole burnout
Yeah,
thing because
that's
I
because
have my own
that is
story with
huge.
that
Yeah,
too.
that is
Yeah.
huge. Burnout is important.
And again, we've only been out for a year and a half, and we're talking about burnout. So they're gonna think we've been in this business for
Dude,
10 years.
two and a
Okay,
half
yeah,
years.
yeah.
Come on.
Clinicals count, right? Clinicals. Oh, you
No,
worked.
dude,
No, you
2018.
worked earlier though. Remember, you were right off the
Yeah,
bat. I wasn't
yeah,
on. So,
yeah. Because I took my boards while I was still in school. I took it in April.
well, listen. It took me 6 months to get my Canadian thing because in Canada, you don't just go, oh, let me write this and write this after. They go, you got to write this. And if you pass it, you can do this.
I know, yeah. And now the Canadian boards have changed with
Yeah, I guess
do
so.
we have time to
No,
talk
I
about
don't know if
this?
we get time
Oh,
to
we
talk
don't
about
have
all
time.
that.
We
I
don't,
don't.
but we will talk about somebody to bring up that Canadian boards are now, how
Yeah,
are they done? They're done like
virtually, online.
virtually. Yeah.
I
That's
don't know.
crazy to me.
I don't know.
We will give our opinions on it another time.
We will definitely talk about that later. But we are listening to your questions. We have gotten some really good questions, and we have a lot of topics to talk about.
Yes, guys,
Um,
keep them coming, please. We love them.
and again, if you're like, you know what, hey guys, talk about this on the next podcast. Hit us up. We'll talk about it. I think right now we're addressing one question per podcast in the beginning.
Yeah, I mean, if there's a bunch of great questions, we will talk about it.
Yeah, we might as well just spend a whole podcast on a bunch of questions. But I think the feedback has been pretty good.
Yeah,
Pretty good
guys, thank
feedback.
you so much. Thank you so much for listening, for watching, however you're tuning in. We are currently on 5 different
Yeah, Apple Podcast is a bit behind
Oh
on
my
us.
gosh,
Eh?
Apple Podcast is taking so long for this to upload, guys. It's a whole process, but we are planning on getting it to Apple Podcast. That's where I listen to my podcast. So I'm sorry it's taking some time. We are on 5 different platforms though, and on YouTube. It is on the way. Hopefully by this week they will accept us, but it just takes some time.
I just realized I'm running my music in the background. I really hope it's not playing.
Oh, oh my gosh. If we Anyway,
right.
guys.
Anyways, guys, we'll see
Thank
you on
you
the next
so
one, right?
much.
Thanks for
Yeah.
listening in.
Thanks for listening.
See you guys.